You know, there's a reason dentists spend several years learning their trade. Our mouths are pretty complicated.
Yeah.
Take cavities, for instance. Now, it's pretty common knowledge that eating foods that are high in sugar and not cleaning your teeth properly can lead to cavities. According to the doctors at Delmarva Dental Services, the science behind what can destroy our teeth is a little more complicated than that. We all know brushing and flossing are key to keeping our teeth healthy and clean, but do you really know why? Dr. Joe Harmon says our mouths are full of bacteria, both good and bad. In fact, he compares it to an ecosystem.
The same thing that you'll see in nature, like the slime on a rock or anywhere there's water, there's a kind of like a biofilm, and this just happens to be a biofilm that's on your teeth.
Harmon says that biofilm is a complex layer of bacteria, and even the way the bacteria works with the tooth is complicated.
If you think of positives and negatives, the tooth actually is negative, and the bacteria is negative. So like charges actually repel. But what bacteria do is they pick up calcium from your saliva, and it makes a positive charge. So they actually use calcium to stick to your teeth.
Once the bacteria or plaque is on your teeth, then it gets to work by taking advantage of your sweet tooth.
For instance, the bacteria that cause cavities eat sugar, and their byproduct is acid. And the acid actually will dissolve your teeth.
Dr. Harmon says another bacteria in your mouth makes enzymes that actually dissolve your bone and gum. That's how you end up with gum disease. And bad breath? Well, you can blame that on plaque too. He says another byproduct of plaque is hydrogen sulfide gas.
Not only that, but it can also, if you have high plaque level or high bacterial levels in your teeth or in your gums, that bacteria goes into your bloodstream as well.
And Dr. Harmon says the same bacteria that cause plaque in your mouth is the same bacteria that cause plaque in your arteries. That's why keeping plaque out of your mouth is key, starting with your diet.
And obviously, if you're eating a lot of sugar, you're feeding the bad guys.
And if you already have plaque, you want to remove it.
Traditionally, the best way to remove it is a brush.
Dr. Harmon recommends an electric toothbrush. But he says brushing alone doesn't complete the job. Not only does flossing get to places the brush can't reach, it disrupts the biofilm.
Where they're all organized while you're going in there disrupting things, and they can't make their chemicals, which cause gum disease and destruction of your enamel with acid. When you floss, you should take out about an 18-inch piece of floss. And there's two ways to do it. You can wrap it around your thumbs like this and use your index fingers, or you can wrap it around another finger and use your thumbs.
Dr. Harmon says to make a C shape when you're flossing.
You're making a C shape and you're scraping the side of the tooth where the toothbrush won't go. And so if you only brush your teeth, you're missing two sides of the tooth.
Dr. Harmon says newer methods such as fluoride varnish make the tooth stronger so the acid can't damage it.
Basically what you do is you paint the tooth with a fluoride varnish, and it lasts from 3 to 6 months.
Dr. Harmon also recommends xylitol gum as a way to keep plaque from forming on the teeth.
Now xylitol is a sugar, and it fools the bacteria. Xylitol, the bacteria take the xylitol in because they think it's a sugar they can use, but they can't. So it actually kills them.
Probiotics are another tool in the fight against cavities. Dr. Harmon says there's a probiotic that replaces the bad bacteria with a good bacteria.
What it does, it crowds them out. And if you, every night you take a probiotic and it just melts in your mouth before, right as soon as you go to bed, you let it melt, and in 3 weeks' time, it's changed the bacteria that cause cavities to bacteria that don't cause cavities.
But Dr. Harmon adds probiotics will not work if you don't reduce the amount of sugar you eat. He says there's even a toothpaste that prevents bacteria from sticking to your teeth using what's called a chelator to remove metals.
Remember I said that the calcium binds the bacteria to make the bacteria stick. Well, the chelator grabs up all the calcium and holds it, and then the bacteria don't have any calcium to become positive, and they stay native and they're repelled by the tooth. So that's a wonderful toothpaste, and it's very, very new, but we've seen great results where people just don't have any plaque on their teeth.
Now, Dr. Harmon says one of the worst things you can do for your teeth is sip on sugary drinks over a long period of time. When you do that, your saliva doesn't have time to neutralize the acid that's left in your mouth. And if you would like to read more about dental health and Delmarva Dental Services, go to our website, WBOC.com, click on our picture at the top of the page.